On World Contraception Day, Planned Parenthood Federation of Nigeria, PPFN, joins the global community in advancing choice, access, and empowerment. Let's hear from our team across the country who are making this vision a reality.
There's a number of them. One that I want to quickly highlight is about the side effects women experience after taking contraception. You find that what works for person A doesn't work for person B in the exact same way. So for example, a woman experiences menstrual irregularities on a particular contraceptive method. Another person will not experience it. So we do our best to counsel in a personalized way. We give you all of the things that could happen, and then we ensure proper follow-up so that even when side effects occur, we are working with you on the journey one step at a time. And this is why it is very good for clients to come to professionals to receive proper counseling and good follow-up care so that they are not put off completely whenever a side effect occurs. Another quick one is when they think that it will affect their fertility journey altogether. Contraceptive methods do not do that. So for example, if you take a hormonal contraceptive method, we'll tell you that when you want to give birth, you can come to us and we'll put a pause on it a few months before the time you want to give birth. So that way you understand that the hormone needs to wear off from your system.
Research has played a very important role in identifying this. In as much as contraception is important and it improves the quality of life and the economic status of a family, research has helped inform us about the needs of people and what are the loopholes in this contraceptive service uptake, what are the misconceptions, and where do we need to do more to get these services even to the marginalized persons and those in the remote areas and also the security troubled zones. In recent times, PPFN has engaged in carrying out the Net Promoter Score, which is to measure the client loyalty, and also we have the quality of care questionnaire which we administer as well, and this has gone a long way in helping PPFN to address the needs of people and also improve in the quality of service delivery at the various facilities. Through Net Promoter Score, we have also measured what have we done well and what do we need to introduce to increase client flow, to increase awareness. The awareness of contraception has spread far and wide. In some situations, you see clients who visit the facility, maybe they came there having myth and misconception about this contraceptive thing, and eventually after taking up the services, they feel good about the whole thing, and then they make referral to their family, friends, or even maybe in churches, workplace, and name it. We have policymakers, yes, but we need equity, effectiveness, and we have implemented policies in the past which we will want to showcase how successful these policies have been and why we are proposing these policies to the policymakers. We need to justify them with evidences.
In that case, we adopt cultural sensitivity framework designed to acknowledge and respect the diverse cultures and the religion background and the communities we serve in that particular region. The approach enables us to build trust and promote acceptance of family planning services and reproductive health, and it leads us to subsidize or give free family planning services, ensuring women, girls, youth, men, and people with disability have quality access to that services regardless of their financial means. We work closely with the religious leaders, with the community leaders, with the youth, women, and healthcare providers. We promote family planning initiatives. We train service providers, mobilizers, as well as conducting assessment and identify areas with high unmet needs by targeting our services to these areas, ensuring the vulnerable population effectively reach and that our services are inclusive and accurate to the individual in that hard-to-reach location.
In PPFN, Planned Parenthood of Nigeria, data is very crucial to our intervention and improving access to contraception across Nigeria by guiding our decision making, optimizing resources used, and strengthening service delivery. We also use data to identify gaps. Definitely, we look through the National Demographic X Survey. We identify the area where there's a group, especially adolescents, where they are not being more access to the contraception, and our findings from them and from our routine data we collect, we also ensure that our intervention is targeted to this set of people, or to ensure that the knowledge and the service of family planning goes around them. And using data in PPFN, we also use to improve the quality of services we are providing, and we also use it to identify our staff that need the capacity, and also other decisions we make in the organization. We have seen notable increase, like 50% in the contraceptive utilization among young people aged 15 to 19 years. But most importantly is that unmarried sexually active adolescents 15 to 24 show much higher contraception use than their unmarried peers. Despite the improvement, barrier in accessing contraception among young still very much. And among those barriers, socio-cultural norms, limited knowledge of that, among provider bias. We see have some providers that they are still having biases in providing these services, and lack of youth-friendly services deter adolescents to access contraception. This is what we have still observed. Accurate reporting is pivotal to shaping national policies on contraception in Nigeria. This determines whether policies are responsive, equitable, and effective. In Nigeria, accurate reporting and evidence are critical for shaping national policies on contraception because they give government partners and other stakeholders a credible basis for decision making.
So the major challenge we had while we were at the field was sociocultural barriers, and that's where the challenges were addressed through the strategy we put in place by ensuring that key stakeholders were fully involved in our intervention. The key stakeholders like community gatekeepers, which include, traditional religious leaders, women leaders, youth leaders, we brought all of them on board, and they seriously supported us. Even at the point of providing these services, even when women, men, they want to accept our services, we try to re-strategize by ensuring that clients were seen by, same sex, male providers or male clients. In addition to that, we had our trained providers on board, and we were able to provide counseling services to women for them to accept family planning services.
major assignment is to make sure that there is commodity throughout our facilities, and through this one we partner with Nigerian government, donors and commodities to strengthen contraceptive supply chain by facilitating data-driven technical assistance. That is ensuring reliable funding through advocacy and resource mobilization, improving logistics management, increase health workers' capacity, and driving commodity engagement to ensure consistent availability and access to contraceptives for all reproductive ages. The partnership with donors, they are the major source of family planning and product in Nigeria. They are the one that even helping Nigeria right from the onset. So the donor, they provide crucial funding to the government, even to most of the NGOs in Nigeria, for procurement, distribution, and other supply chain operations, preventing commodity stockout. Also, they give technical and logistic support. Most of the commodities they purchase are being kept at the central store, Lagos, and redistribution of commodity to the state. Even some, they made provision for distribution to the warehouse at the state. But from the state down to the facilities, some states, they don't have the capacity to do it. And some that have, they don't have the capacity to procure consumable. So that is why many of those commodities, they will lie down in the central state medical stores, get expired. And those that manage to distribute their own, the problem of no consumables, and they have to be charged because just of this, Nigeria is practicing free commodity for all the clients. But the issue of consumable is another thing that Nigeria needs to look to. Also, information sharing. NGOs and partners, they make market data information with international donors to shape the global market and secure a reliable supply of contraceptives. So also we have partnership with communities. We have the donors, we have the communities. With the communities, we inform choice and demand creation. PPFN, for example, conduct the move from one place to the other. Just like this outreach that they are doing. From there, they create demand. Those people that are not aware, all those areas that cannot be reached, even those people that they don't even have transport or whatsoever, where they gather them somewhere in the urban or rural area. So through that one, they'll be able to create. Also, community mobilization is part of it. Accountability and transparency is part of it. Also, coordination and capacity building, as I've said before.
In Southeast, we're just Nigeria as a whole, we're a religious nation, we're a culturally oriented nation. We make use of generally acceptable pathways to ensure that we have one-on-one contact with our clients. We will now introduce other family planning methods to them. That general meeting point is through cervical cancer screening that ensures that the woman's cervix is free of anything that is cancer inducing. So when they come for cervical cancer screening, we have the room to educate them on other methods of family planning, and at the end of the day, you see that the client loves it. She gets to take it up. And number two is that we make use of male involvement. Most of organizations are scaring away from the men. They run away from, they focus on the women. So in PPFN Southeast region, we make sure that we involve the men who are the gatekeepers of the communities. They are the traditional rulers. They are in charge of the churches and the mosques. So we make sure that we involve them, take permission from them, they become our voice, and then they push forward our information. We also render family planning oriented services that target the men, such as use of male condoms and prostate testing. Having a contraceptive method that is client-centered has to do with giving contraceptive services that the client loves. So when we render these services to the clients, we make sure that we get feedback from them. We do this by use of suggestion boxes and client exit interview. So they tell us how they felt about our services, whether they are happy about it, if they had any side effects on them, which we can make a readjustment to, and also bring out something that is 100% close to that in giving them what they want.
In Southeast region, community partnership, we can't do without it. When we come to a community, we make them own the programs, contraceptive programs. We make it to be their thing. It's not our thing, because if you make it to be our thing, they will shy away from it. Okay, so we make sure that we get them involved, mobilize, get people together that are close to those in the community to speak for us. We also give them incentives to patent medicine stores. We train service providers that are close to these communities, so that they will be able to speak for us, speak on our behalf, and also own the program. That is how we push contraceptive services in the Southeast.
You see, Nigeria has a population of over 230 million. And you may wish to know that Nigeria has a what they call youthful population because of high birth rates. It's also along with high death rates. Nigeria contributes 2.8% of the world population, and issues that have to do with maternal mortality, we are ranging the highest. So, and when you look at it, because of the high birth rates and the youthful population, Nigeria becomes significant in terms of population, and this population can be worked upon to improve in the potential of these youths. And then we have youths that are in their reproductive age. If we want to invest properly into this youthful age, we must address family planning, which is contraception. Contra means against, section means to take in. So if we address the different methods that are involved in contraception, definitely we can manage the population with the advantage of the youthful population, meaning the challenges of education, the challenges of health care, challenges of environmental care or climate change, even unemployment or employment. So if we can invest in family planning, to go a long way in improving the quality of life of Nigeria. PFN, being the foremost family planning organization, now reproductive health organization, is the first in this country. It started with people with good spirited mind in Lagos, and today BPFN has contributed a lot in terms of improving maternal mortality and child mortality, also morbidity. We are foremost advocates of SRH and R in this country, and as a member of IPPF, we also believe in working in partnership. So we have trained a lot of people who work in partnership with other stakeholders with the same aim and objective to making sure that everybody's life is important. Quality of life is also maintained, making sure that the youthful population is also matched with proper infrastructure, just like I've said. So BPFN has helped in contributed in reducing maternal mortality, morbidity, child mortality and morbidity. Also contribute in the area of reducing communicable diseases as well. So also even non-communicable diseases. At a point in the provision of services in this country, we have actually contributed to 10%, Federal Ministry of Health of Nigeria, of improving on what they call MCPR, therefore reducing maternal mortality. We want every pregnancy count, and nobody should just have unwanted pregnancy. You only give birth when you think the couple are capable of giving birth to the child that they can provide for. And even if you don't have, we also provide infertility services, both for primary and secondary infertility cases. So it is not as if we are trying to limit people from giving birth. We also encourage you to also give birth, but that to live a quality life, mother, child, and the family. And by so doing, we improve the economy of the family, we improve the economy of the community, we improve the economy of the state, and by and large, the country. You know, when you talk about family planning commodities, you need to buy, you need to procure them. And we getting this family planning method is through UNFP, like other countries. But there's what they call counterpart funding. And in Nigeria, through Federal Ministry of Health, they have to provide the counterpart funding, or even budget and planning. But that if there is no budget line, that is where you have the challenge. And today, we are able to, Nigeria has actually promised from the London 2012 Family Planning Summit that they are going to improve on the family planning budget. We have moved from 4 billion to I think about 6 billion recently, and Nigeria has been trying to provide counterpart funding for what UNFPA will provide, because we need it. Those are the challenges. So now it is the timely release of this money that we are having challenges with now. Timely release of this money, we have to train service providers to offer quality services. And above all, we also need the government to also explore non-governmental area to improving the economy or improving funding family planning. Yes, the more the merrier. We have to partner. If you look at the SDG 17, partnership is there. But whatever thing you are doing, only you can do it alone. So if we have stakeholders like mine, we can expand services to all the nooks and crannies of Nigeria, and therefore meeting the needs of beneficiaries. So if we have extended service providers in every nook, because our own channel here is outreaches, we also use the cluster model to expand access. We also do door-to-door services. We also use CHU. These are the ways we think we can expand services so as to meet up with the demand. We have a very high on unmet need. Beneficiaries they want, but methods are not available. So we must also raise up to see that yes, you have this commodity available, not only through PPFN, through all these other stakeholders and through all these channels as I've mentioned, to get it to the beneficiaries. The World Contraception Day 2025, I want us to include the marginalized groups, inclusivity, the people that are vulnerable, marginalized, or you call them disabled, they are also part of the work. So anytime this year that we are going to celebrate it, please remember the vulnerable and the marginalized people, especially in the community or in the rural area.
Contraception means choice. It means health. It means empowerment. Let's work together for a future where everyone has access to safe and reliable family planning.